Welcome back to Health Class. We're teaching health by all means and by any means necessary. I'm your virtual health specialist, Sherry Griffith. They call me the health teacher.
And I'm Dwayne Johnson, aka The Rock, former health professional, educator, now turned technology coordinator.
Well, we're here to help you be the best health teacher you can be.
These students not only are they're growing up in the pandemic. My son started pre-K during the pandemic. He was starting pre-K, right? Well, he was going to pre-K that fall of 2020. He's now going to be a first grader, coming up in August. So his whole school career, he only knows how to learn in a pandemic.
Wow.
So that puts a lot in perspective. He has not had a year yet of school not being in a pandemic. It's scary, but it's real. It is what it is. And we can't go back and erase anything. Only thing we can do is learn our lessons from the past and improve and make better decisions and make informed decisions on our health. Everybody has that ability and everybody has the right to do whatever they want and please. But all we ask is that just to have consideration of that your decision does influence others. No matter whether we like to think of it or not, our personal bubble, our personal space, unless you live on an island by yourself, will always be invaded by someone. So just with that in the pandemic, I can honestly say just I'm kind of a germaphobe. If you know me, I'm kind of a germaphobe. So imagine me going through a pandemic being a germaphobe. I mean, we on lockdown, we didn't go anywhere. I mean, I ordered everything delivered to my house. Fortunately, we never ran out of toilet paper because, over prepared me, always finds a way. We always had soap. We always had food. We always had, the necessities that we needed the entire time on lockdown. But it didn't really get real to me. I mean, and I did my research. Everybody was online. We watched the news. We were on the CDC website. As health professionals, we knew what was going on at all times. And I was able to decode a lot of what was going on with, public health as a whole and relay it to my family and my wife, who kind of didn't understand exactly, everything that was going on, what exactly endemic, pandemic, epidemic, what all that stuff meant. And I was able to break it down to her, but it didn't really get real to me until about November 2020. And this is before vaccines were available. And my mother contracted COVID, who was like at the time, like 62 years old, 63 years old. And, and you look at the news every day and they're reporting on the ages of the, deaths due to COVID. And it really changed how I looked at everything because those 2 weeks were like a nightmare for me and my family because, my mom being the strongest person in the family comes down with the worst disease known to man, or the most unknown one known to man at the time, without protection. And to be honest with you, she has not been the same since. Physically, she's still recovering, and we still have her. We're blessed that she survived it. She's a very strong woman, like I said before, but it has changed her whole quality of life. And only if she could have had the vaccine available to her in November 2020, that, hopefully, she gets through it and she improves and gets better. But, with that being said, that was the start of the nightmare for me, and I lost an uncle in February of 2021. My oldest uncle, I lost him to COVID. And, it just, it just did something to me. And mind you, at this point, I haven't seen my family. I haven't seen any of them since probably, you know, the break of 2019 going into 2020. I haven't seen any of my family members. So I lost my grandfather, I lost my grandmother, and I lost my another uncle. And I lost three family members in a 30-day span in 2020.
Wow.
My grandmother, my grandfather, my uncle, none of them, thankfully, none of them took COVID. Had other issues going on. But, the first uncle I did mention, I lost in 2021. He did die of COVID. But those three family members I lost at a time where I could not see my family was probably the worst thing I've probably had to experience in my life as a professional, as a human being. It was just, it almost felt inhumane, but I knew it was the right thing. It was the right decision to make by, not coming down with family, because we were on a pretty harsh lockdown between April and, June of 2020. So just thinking about those times and how we got through those times, I'm still recovering emotionally, and socially from it. I mean, I'm not even the same socially. So I couldn't even imagine what our students are going through right now at this time. Because if I lost family members during the pandemic, imagine being a 12-year-old and losing family members and can't be comforted by family members because you're not allowed to be in close proximity to anybody, or you had to wear a mask, or you had to, keep your 6 feet distance from everybody. And, sometimes, a hug can solve anything, right? Can resolve anything. And you couldn't even do that during a time where, our students who need that physical close proximity contact, couldn't get it, and that kind of spilled over into to the poor mental health that we're seeing right now of students not being able to cope with what they were seeing. Visually, sometimes what you see um, is the strongest thing ever. Just to transfer that image that you see to your brain, you want a response, right? Or your brain is going to have a response. And sometimes the response that we needed wasn't available to us, and I bring up things like a hug or comfort from that family member, or just to see that family member. We had Skype and we had Teams and we had Zoom or whatever, but it just wasn't the same. Our students were, I heard the stories of the students, I heard health teachers, literally that's all they talked about all day. They tried to teach, but students just wanted somebody to talk to. And like I said, I'll go back to it before, I'm kind of a little envious of that you were able to be a health teacher and provide as much support as you could. And I know times were tough, and during the pandemic, but how were you dealing with it as a teacher? I'm just curious, to know, and I'm sure they were ready to talk and ready to spill everything, and ask questions, right? You were the health teacher. You had all the answers, right? I could imagine that they were turning to you. You were the superhero at the time because, the COVID-19 was about health and you were the health teacher.
That need that you spoke of, that need, that great human need that we all have to be there, to have support, social health, emotional health, mental health. We talk about the health triangle and how these other parts can build up our physical health. And I found as we move forward in the pandemic that it's really been the case. It's really been what's been getting us through as we transition back into our new everyday. We have people who, in this new normal, are wearing masks, people who are not, people who are careful, who are not careful, people who are supportive, who are not supportive. Considerate, not considerate. We have kids who are face to face, kids that are virtual. And so I think now in health education, our big biggest goal is to move forward together, supporting everybody, however we can, by any means, by all means. It's funny, moving forward, one instructional resource. It's a super, super famous movie. I don't necessarily show this whole movie, but lots of video segments, class hooks, in reference to Osmosis Jones. Osmosis Jones. I don't know if you know anything about that.
A little bit.
So, a virus similar to COVID, a man contracts from his behavior. Um, he actually has a hard boiled egg in his pocket. He pulls it out. He's cleaning animal cages at the same time because he works in a zoo. He fights a monkey for this egg. It drops in the monkey litter, and he says 10-second rule. Pick it up and eat it. He eats this egg and contracts a virus whose main goal in its virus life is to be in the medical books, to break world history records, to take out as many lives as it possibly can. It's a very interesting situation. And so the whole time, kids who are virtual, kids who are face to face, as they're watching this, determining how, and this is just lesson plans everywhere for this instructional resource, how his self-esteem comes into play. If he values himself, would he really be doing this? But it all, as the movie unfolds, you find out that this is happening because his wife died. Because his wife died, and he stops taking care of himself the same. He believes that it's just because he's getting old, more so than taking care of his body. And you have this child who's the age of our middle school students, who is his child, his daughter, who is a health advocate. Thanks for joining us. Is there anything you'd like to say to the people?
Just thank you for being there. Thank you for listening today. And remember to continue to educate and to be that health teacher for yourself, your family, your friends, and for everyone around you. And we appreciate you.
Health classes for everybody. Thanks for joining us. Y'all remember out there, if you don't have your health, you don't have your life. Thank you.